Ladies and gentlemen, our next speaker is Mike McGovern. At present, he is the international chair of the PolioPlus committee. And ladies and gentlemen, I want to tell you that this is one heck of a big deal. Mike sits in meetings at tables with prime ministers, presidents, the Bill and Melinda Gates Foundation, leaders at the World Health Organization, UNICEF, and the CDC. As well, he was a trustee of the Rotary Foundation in the year 2012 to 2016, and he was a Rotary International Vice President in the year 2007 and 2008. Mike is truly one of our most amazing people in the world of polio eradication. Mike, the floor is yours.
Thank you very much, Nick, and sorry for the little delay getting my slides up. The organizing group tonight has asked me to present an overview of where we are now, where we've come from, and where we're going. They had some specific questions, and that's what I plan to address in the 8 minutes or so that I have this evening. If you look at this slide, together, it's all about working together. It's all about impact, and it's all about action. And we've gotten as far as we have because Rotarians are truly people of action, and because we've worked together with other parties to do it. And we often focus, and we see on Facebook and otherwise the focus on the number of cases every week. But sometimes these other statistics which are on this slide, I think people aren't as well aware of. We have 19 million people now walking on this earth. 19 million people, because we have impact. Together we took action. We're preventing 650,000 cases a year. We've immunized 3 billion children. And just look at these statistics for the last calendar year, 2019. More than 430 million children were immunized, and we used 1.2 billion doses of oral polio vaccine. And look at the period of time we've gone without cases outside Pakistan and Afghanistan. Yeah, we're a little disappointed. We've had more cases, but look at this progress. As Rotarians, we ought to be so proud of the impact that we have had. One of the questions I had was, Mike, would you explain circulating vaccine-derived polio cases? And if you look at the far right of this chart, it's we've had about 121 cases of wild polio virus in Afghanistan and Pakistan so far this year. Well, we've had 302 of this vaccine-derived polio virus. So what is this? People think that we're giving the polio drop to someone and they immediately are getting the virus vaccine-derived. That's not what it is. The folks who are getting it are the folks that aren't getting vaccines at all. So their immunity systems have not built up. And what happens is we give the oral polio virus to people, they secrete it onto the ground, and then it mutates. And the weakened virus that's contained in the oral polio vaccine then emerges in these underutilized, under-immunized populations. So it's an expensive undertaking for us because we're having to go in and do outbreak control in a lot of these countries where the 302 cases are. It is a setback. It was unexpected. But the people, well, what are you doing to deal with it? What's the partnership doing? It can be stopped with this new oral polio vaccine that's been developed over the last 10 years, paid for by the Gates Foundation, by the way. We expect an early use license very, very soon. We're also continuing to give the injectable polio vaccine, which does not contain a live virus. It's inactivated. That's being funded by Gavi. So you can see the importance here. We are addressing this. It is going to be addressed, but in the meantime, sadly, there's people getting cases, and as you can see, it's affecting kids the same way as the regular wild polio virus, sadly. We also are dealing with COVID. And that was another question that was posed. This is Dr. Moetti. Dr. Moetti, as you can see, is the regional director of the World Health Organization, Africa region. And the district governor, Aruna, just mentioned, the big success, the big celebration of that Africa was declared polio-free. Look at her comment here. It's the extensive polio response network that was created because of Rotary's initiative that is lending the crucial support to countries that contain COVID-19. So, what are the GPEI is the Global Polio Eradication Initiative. And actually, these 2 slides now I got from the World Health Organization yesterday. And, and I had asked them in preparation for tonight, so tell me, give me the facts of, what is our contribution to COVID-19? And, they define it as substantial and essential. And this is, some that we've already done. It says through December, some is agreed to. There's 4,000 WHO polio staff in countries that are responding, polio staff. And it's the value of this is $61 million. There's other monies that come into the partnership. Our share of that is about $10 million. We expect that it might be reimbursed. We've been told that it will be. We'll see. But they're using the polio network's experience for introducing vaccine. And when we hear about the COVID vaccine in our countries, we're hearing about all the issues of the problems there's going to be with vaccine introduction. In the polio field, we have that experience. We have the experience with logistics. We know how to reach the remote communities. So we're going to provide immeasurable support going ahead with our experience and with our knowledge. It also highlights the importance of all of the sustaining capacities that we have, because we're really concerned with longer-term preparedness and resilient health systems. Our goal as Rotarians is the certification of the end of the wild polio virus. And in the meantime, we are taking care as well of these circulating viruses. And so we really need the longer-term preparedness and resilient health systems, because we're still going to have some of those cases after we actually certify the world free of the wild polio virus. Other contributions for COVID, it's the surveillance system, it's the transportation, the cold chain, it's the laboratories. In Pakistan, President Holger Kanak of Rotary this year and our trustee chair, Ravi Ravindran, visited this polio emergency operations center in February. They saw this, but now this polio center, in addition to still helping with polio, is providing the data and analysis for COVID-19, immense contribution. It's an opportunity for us to further polio transition, which means, eventually, with polio, we want this network supported by countries to make sure we keep polio out, and also that we have integration. You can see all these things we're doing in Yemen as well. So, going forward, we still have, we focused on Pakistan and Afghanistan, but technically these countries are in the area that has not been certified free of the wild polio virus. These are all important countries. You look at them. Fortunately, none of them except for the two countries have had the two cases, but there's a population of 583 million. You see a few of them are actually in Northern Africa. So, so we talk about certifying the Afro region, but technically, for those of you that follow these things, there are still a few countries in Africa. So what do we need to do to finish the job? Rotary's done a wonderful job advocating the governments of the world, particularly in the endemic countries, the African countries. It was in large part Rotary, but working with our partners to convince the countries to take on these programs. John Germ's going to talk about the goal and the match. I'll defer to him on that. We need, as I mentioned, to stop the vaccine-derived cases, and everyone needs to look at these websites to find out more about polio. The one I skipped over, we need to convince parents and leaders. In my view, that's our number one challenge. That is how we're going to eradicate polio. We need to work with groups, anti-government elements in some countries, but most of all, and why I included this picture, this is a woman in Abuja, and we were doing the immunization activity there, and she arrived late, and she came running in all apologetic, can I still get my kid the polio vaccine? You look at that smile on her face, and I ruined the picture, but sometimes you wonder if you get thanks for what you do. All you need to do is look at that woman's face. And if we get every mother, every father in Afghanistan and Pakistan to think the same way this woman does of the importance of immunizations, we're going to get there very soon. So, we need to remain confident we're going to eradicate polio. We've had tremendous success. We have a few challenges right now, just like everyone else does in the world. But Rotarians are passionate, they're resilient, and they have the persistence and patience to get this done. So thrilled, Nick, to participate with you today. And I truly want to thank all the Rotarians and other friends of Rotary on tonight's call for their support. So thank you, Nick.
Thank you very much, Mike. That was absolutely such fantastic data and passion. And we want to thank you again for all your efforts and your career really in the eradication of polio. It reminds me of the importance of vaccinating, our children, not only our children, but to get our vaccinations of adults as well. As a general practitioner in Canada, I'm still seeing more and more vaccine hesitancy. And I think it's happening in North America and in the globe. And if I may offer some personal thoughts on that, and you may encounter people globally or in your community who have questions about the safety of vaccines, whether it's polio or any of other vaccines that we have. In my experience, when you're dealing with people who have vaccine hesitancy, I think the best way to deal with them is with kindness as opposed to hostility, really to have an open conversation. And I think to ask them questions. Why is it they have their views that they have, and then base your arguments on science and data, which there is plenty of it out there. And a lot of times these folks are given misinformation and false data from various social media sites. And so I think it behooves us to be kind to them and have an open dialogue and present data and science to present to them. And I think Mike has got his hand up and would like to comment.
Yeah, just quickly, Nick, you're absolutely right. And our challenge truly is that they not see this as our program, that they see it as their program. And if we can have them totally embrace it as their program, we're there.
Really good advice. Thank you very much.